UroPatient, tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to UroPatient. I'm your host, Vic Senese. Got a great show for you today. Hey, if you could do me a favor, like and subscribe. We're getting so close to 5,000 subscribers that, you can't help but try, right? All right. Today, are you tired of dealing with constant UTIs? You're not alone, and you don't have to keep suffering in silence. Stop UTIs for good. In today's episode, I break down expert-backed strategies to help you prevent and treat bladder infections before they take over your life. Learn what really works and what probably doesn't. Discover simple daily habits you can do to reduce your risk. Get clarity on treatment options beyond antibiotics. So whether you're dealing with recurrent UTIs or just want to stay ahead of your urinary health, this episode is packed with practical, real-world advice you can use right now. So let's get
Recurrent bladder infections. They are just the worst, aren't they? So today we are going to cut through all the noise and give you some real expert advice on how to actually prevent them. Let's get right into it.
You know that feeling? It's this endless cycle of pain, that constant need to go, and just the worry that hangs over you. If you are so tired of planning your whole life around when the next UTI might strike, then you've come to the right place. We are going to get you some real answers.
So here's our game plan for today. First up, we'll talk about how to even know you have an infection. Then we're going to bust some big myths about what causes them. After that, we'll get to the good stuff. 5 real, concrete strategies to prevent them. And yep, we are finally going to settle that whole cranberry juice debate for good. All right, first things first, before we can solve the problem, we've got to know exactly what we're looking for, right?
It's not always that classic burning feeling. You might just feel like you have to go to the bathroom all the time. Or maybe you feel this pressure down in your lower abdomen. Even something like new or worse bladder leakage can be a sign. And hey, if you ever see blood in your urine, that is a huge red flag. Any of these symptoms mean it's time to get things checked out.
Okay, and this is super important, especially if you get these infections over and over again. See, a regular test might just tell you, yep, you've got an infection, but a urine culture, that's the real detective work. It tells your doctor exactly which bacteria is the culprit and, this is the key part, which antibiotics will actually kill it. This is how you stop guessing and start getting the right treatment.
Okay, let's talk about something really important. Because there is so much bad information out there that just makes people feel stressed and guilty for no reason. It's time to separate fact from fiction. So, on one side, we have the real risk factors. Things like going through menopause, having diabetes, or even your family history. Those can actually increase your risk. But then look at the other side. Hygiene, which direction you wipe, the kind of underwear you wear. Turns out these are not linked to recurrent UTIs. So please, you can officially stop blaming yourself or worrying about these things.
I really want this to sink in for a moment. This quote is from Dr. Rina Malik, a urologist, and it is so powerful. Because you are getting infections does not mean you are dirty. It's a medical problem. It is not a hygiene problem, period.
All right, now for the part you've been waiting for. We've busted the myths, so let's focus on what you can actually do. We're about to walk through 5 evidence-based strategies that can truly make a difference. So here's our 5-step game plan. We're going to talk about drinking more water, avoiding certain products with spermicide, dealing with bladder emptying issues, thinking about vaginal estrogen, and, you guessed it, using cranberry supplements the right way. Let's get into it.
Okay, step 1. It sounds so simple, but it is incredibly powerful. Drink more water. And I don't just mean an extra glass here or there. There was this amazing study where they took women who got UTIs all the time and had them drink an additional 1.5 liters of water every single day. And what happened? It was incredible.
Yeah, you are seeing that number correctly. Almost half, a 46% drop in infections just from water. Think about it. You're literally flushing the bacteria out of your bladder before it has a chance to stick around and cause trouble. It's probably the easiest and most effective thing you can start doing today.
All right, step 2 is a really quick but important one.
You need to check your products for spermicide. It can be in some lubricants or certain contraceptives, and studies show it can mess with the good bacteria down there, which makes you more likely to get an infection. So just take a quick look at the labels.
Step 3 is something called dysfunctional voiding. And that's just a fancy way of saying you're not emptying your bladder all the way. And any urine left behind, well, that's like a perfect little puddle for bacteria to grow in. So if you feel like you have to push or strain, or you just never feel completely empty, you should see a pelvic floor physical therapist. They are amazing specialists who can help you retrain those muscles and fix the problem. Okay, this next one is a huge one, especially for postmenopausal women. See, estrogen actually plays a big protective role. It helps keep the vaginal environment healthy and acidic, which stops bad bacteria from taking over. But after menopause, estrogen levels drop and that protection goes away. Using a low-dose vaginal estrogen cream or suppository can bring that protection right back and seriously cut down your risk of UTIs.
And that brings us to our last strategy, and it's the one everybody asks about: cranberries. Does cranberry juice actually work? Well, the answer is kinda yes and kinda no. It's complicated, but we are about to make it really simple for you.
Okay, let's get right to it. The cranberry juice cocktail you grab at the grocery store? It's not going to prevent a UTI. It's just loaded with sugar and it doesn't have nearly enough of the secret ingredient. The real power isn't in the juice itself, it's in a very specific compound inside the cranberry.
And this is it: proanthocyanidins. Let's just call them PACs. It's way easier. The best way to think about PACs is like a Teflon, non-stick coating for the inside of your bladder. They basically make the bladder wall super slippery, so bacteria like E. coli can't grab on and start an infection. They just get flushed right out. But here's the catch. For that non-stick magic to work, you need a very specific amount. The research is clear. The effective dose is 36 milligrams of PACs every day. You are never ever going to get that from juice. This number, 36 milligrams, is the most important thing to look for.
So when you're looking for a supplement, here's what you need to do. It's your 3-point checklist. Number 1, read the label and make sure it says it has 36 milligrams of PACs. Number 2, make sure it's soluble. And number 3, check that it's made from the cranberry juice extract, not the skins or stems, because that's where the good stuff is. Wow, okay, we have covered a ton of ground today, right? From understanding the real symptoms to busting those frustrating myths and laying out 5 real strategies you can use. The power to change this cycle is really in your hands now. So my question for you is, after hearing all this, what's one change, just one thing, that you're going to start today to take back control?
All right. Well, let me know in the comments if you like those videos or if you prefer that I present the topics with slides. I've been kind of messing around with both. I really kind of like these myself. I think it's all information that I go ahead and get for you guys. So it's all evidence-based, but I think that this kind of nice little way it presents it and not always having to do all the speaking myself is an option. So put it in the comments, let me know, and I'll go with whichever way everybody likes the most. All right. So next week, if you're someone you love, if you or someone you love is dealing with a weak stream, frequent nighttime trips, or trouble emptying the bladder, might be due to prostate enlargement causing urinary blockage. Next week on UroPatient, I'm going to have a special guest, Dr. John Lynn, and he's going to break down what the gold standard surgical options are that every man should know. So be sure to tune in next week and figure out what's best for you. Until then, enjoy today's the day before Easter. So enjoy your Easter tomorrow, and we'll see everybody next week.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby, your health for you and me. Knowledge is power, we make it clear. Every Saturday morning, the podcast is here.